You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. With us, we have Oregon's go-to couple when people want a natural-looking smile, Dr. Haddad and Dr. Ogawa. Welcome to the program.
Thank you. Nice to be with you, Randy.
Thank you, Randy.
Now, you are a married couple, right?
Yes.
You work together, met in dental school, is that right?
Absolutely. First year of dental school.
Started the practice together?
Yes, pretty much.
So who's your typical patient? I mean, tell me about your practice. We've invited you in the program to talk about cosmetic dentistry specifically, but you do much more than that.
Yes,
so,
absolutely.
Why don't you tell me who the typical patient is?
Well, it's really hard to pin down a typical patient. I mean, our patient can be male or female from 20 to 90 years old. They come to us for different reasons.
Like, I mean, you do all the general dentistry, like fillings and...
We do all sorts of dentistry, be it from root canals to whitening of teeth to fillings and cleanings and crowns.
Now, are there any things that you do that she does not do, or vice versa?
I do the dentures, and most of my dentures are implant supported.
So like a snap in, snap out, or fixed?
Yes.
Fixed? Okay.
Yes. We even have a model of it. It looks just like that. And
2 dental implants just kind of secure that lower denture.
Yeah. Much higher quality of life.
So what are the different categories in cosmetic dentistry that you see?
Really, anybody that doesn't like their smile and wants to have a better smile, and it can be denture patient and wants to have beautiful dentures. It could be a person with worn teeth, rampant decay in their teeth. They want it fixed up, and it may be for functional or health reasons, but they want it to look good.
They want it to look good. Now, I understand you were in what's called temporaries. You're about to get veneers. So those are temporaries?
Yes, they are.
Okay. And they look good.
Thank you.
Whose idea was that? Was that yours? Was it yours?
That was hers.
We both kind of thought of it, and I've been thinking about it for a while because I know when he smiles, he has a nice smile, but especially for a dentist, I just thought...
You wanted to pick it up a notch.
Yes, I did.
Yeah.
Now, your background, your training, a lot of education after dental school. Tell me about that.
Hundreds of hours, Randy, literally. A lot of hands-on on patients, live patients, where we do a lot of training and specialty training, not just in cosmetic dentistry, but in bonding the stuff as well.
Now, you told me about you both attended, I guess you're graduates of LVI.
Yes, we are.
Dentists from all over the country go there. It's like what Juilliard is to music. I mean, this is the place to go for cosmetics.
Absolutely.
You both graduated there.
The premier place, yes. And as a matter of fact, we're fellows.
Is there that much to it, though? It seems pretty straightforward.
There is a lot.
Really, there's a lot to it, to creating what? A natural smile, I guess.
Yes.
Well, people think a tooth is a tooth, and as long as it's white and straight, that's all that counts.
Yeah.
But there's a lot more to it artistically and scientifically than just making them look straight and pretty.
Now, you say in your practice, somebody goes in, you change their smile, and you could change their life.
Oh, definitely.
Really?
Definitely. We change their lives in so many ways.
Okay.
We change not only the look, but let me show you an example here.
All right.
Take a look at this picture. He was actually losing jobs because people didn't want someone scary looking working on the property.
That's a good way to put it. He looks scary. I mean, is this one where you see it, you go, oh, this is going to be good?
Yes, it is.
I mean, do you see that? I mean, when you're with him?
Yeah. You definitely think this is going to be a good case. We're going to change this person's life.
All right, so what did you do for him specifically? Okay, so you took care of that stuff. You gave him what, veneers?
Yes, we gave him veneers. We gave him a couple of implants to replace his missing teeth. Took care of his gum disease.
Let's take a look.
There he is right there.
Doesn't look like the same guy.
No, the difference is not just in the teeth.
Yeah.
The look of pain.
Well, he looks more successful, more sophisticated.
He has a lot more confidence.
Yeah.
And he's doing a lot better in his career now.
So people were treating him differently.
Absolutely, Randy. People were looking down on him, and when he went to go to airports and such, people would kind of move out of the way for him.
That's what he would tell you. He would tell you that.
Absolutely. He's told me that a couple times when he comes in. And his girlfriend was going to actually leave him because
of his teeth.
Because of his teeth, because he never smiled.
I guess it's not that funny, but so, but okay. So is this that typical? I mean, when you look at a smile like this,
Yes. In fact, we've heard those same stories before. We had a patient that had teeth like that, and people would not sit on the same park bench as him. He said that he thought that everyone thought he was homeless.
Just because of his teeth.
Yeah.
Here's a patient of mine, Randy, as a matter of fact. She's a lady.
So that's her smile.
That's her smile,
She's not
Randy.
smiling, though.
Absolutely, you're right. She smiles with her mouth closed.
Okay.
And
A lot of patients do that.
Oh, they do. They learn how to smile with mouths closed. Okay.
Yeah, it's very unfortunate. And so a lot of her friends thought that she was stuck up and she was just angry and upset all the time.
Just
in
because she didn't
reality,
smile.
yeah, in reality, she just was afraid of her smile. You look at the second picture. She had a lot of old dentistry.
Like the gray line at the top.
Absolutely, right in the middle of
What
those
is that?
front
What is
teeth.
that?
That's actually metal underneath the crowns, and it's just old looking, and it just makes the teeth look gray and dark and ugly. What motivated her was in August, she's going on a trip to Paris, and she just wanted to have a gorgeous smile and have photos of her literally smiling.
Well, that's nice. That's nice.
Yes, instead of just smiling with the mouth closed.
That's the thing. With a lot of our patients, they have a specific reason, a specific event that they want to be able to smile at. And it's often a daughter or son's wedding.
Okay.
It's an anniversary. It's a reunion, family reunion, class reunion.
What about divorce? Some people
Yes.
dating again.
Yes, some people have to get back into the dating field, and they want to feel more confident, and so they get their smiles fixed up. And people tell us that it really makes a difference in how well they do in that dating game.
Randy, will look at her after smile. Doesn't she look gorgeous?
Looks
And
good.
This is her smiling without us asking her to smile. That's just her natural look. She's just getting used to it. And all we
What
did.
do they say to you, by the way, when it's all done? They look at themselves in the mirror, like a woman like this. What happens? Do they get tears?
Most of the time, you're absolutely right. Most of the time, it's just tears and a lot of emotion and a lot of relief. They say, "I can't believe that I didn't get this done earlier, and I should have done it earlier."
Okay.
And we
And
have
it was-
a lot of men, too,
A lot of men that
cry
come
in
in.
the chair.
Really?
Yes.
The men are crying in the chair because it looks so good.
Yes.
Oh yes.
Are these real men, though?
Yeah,
I'm kidding. I'm
yes.
kidding. So is it a mix? Is it more women, more men? What is it?
It's about 50-50.
50-50. I mean, because it's become mainstream, I guess. People that are getting veneers on their teeth.
A lot of men are
People,
doing it actually.
Okay.
Men just as much as women, especially to get a better job out on the market nowadays, just to give them that
But I
edge.
feel that, we've talked off camera about this, that I could spot veneers, 10, 20 yards away.
Well, look
Big
at-
horse teeth.
Look at
No.
that patient, Randy. Do you think that looks
Okay,
like?
well, like this guy. You're right. Okay, good.
Yeah. Do you think that his teeth look fake?
No.
How about that woman there?
So when I see those, the bigger teeth, things like that, so it's in the hands of the dentist.
When someone comes in, I can actually envision what the final outcome is, just like an artist can envision a piece of wood
final.
that they're carving. Oh, absolutely. Absolutely. Within 2 seconds.
Does the patient have some say-so? Obviously they do, but it seems like the fear would be, what is it going to look like?
Oh, we give people a lot of options in the smile. We actually have a smile catalog. And
So they pick their smile.
oh, absolutely. And all the subtle changes that we do, it's just amazing because it gives a totally different look with using the same type of teeth, but just kind of contour some teeth or lengthen some teeth.
Do
It
they ever
just
bring
gives
a
it a look.
picture of like a celebrity and
Yes,
say, I
that's
want
very
these
common.
teeth?
They will
They ever bring a picture of me in there?
No, sorry,
Not yet,
you.
Okay.
not
I'm
yet,
kidding.
but we will, I'm sure, because you have a
Eventually.
gorgeous smile.
Oh, well, thank you very much. So they take part in what their smile is going to look like.
Yes, in
And
fact,
obviously you work it up.
sometimes they really want to look younger. So what they'll do is bring us a picture of themselves younger and ask us to duplicate that smile.
And what we actually do is we even simulate what that smile actually looks with their present facial looks
How?
right now through a computerized programming.
Okay. You two don't seem like dentists, by the way. You seem very nice. Are people still afraid of going to the dentist? Do you hear that? Do they say, I don't like going to the dentist?
Unfortunately,
Yes, they
yes.
do.
Like how often do you hear it?
almost every day.
Like, how do they say it? They just say, I don't like being here? What do they say?
They
That's
say,
one
I
of
hate
them.
the dentist.
They say, I hate the dentist.
I hate coming here.
Are
Nothing
you tired of hearing
personal.
that? Oh, nothing personal. I just hate coming here.
Yes.
But does that turn around?
Oh,
After a
certainly.
while?
Absolutely. As a matter of fact, last week I had this gal. She came in and she was really afraid of dentistry. And the first time she came in, she actually had her husband come in, and he was holding her hand the entire time. And she was pretty much in tears, unfortunately. She had conscious sedation, and after the third time when I saw her the other day, she said, I cannot wait to come in. I was looking forward to
Sounds like
seeing
an
you.
exaggeration. Is she exaggerating a little
No,
bit? You're her
not
husband.
at all. Not at all.